guys, welcome to my channel. This time we talk about forearm anatomy. So definition is the part of the upper limb between elbow and wrist. This is elbow and this is the wrist. So we have two compartments, anterior compartment and posterior compartment. This video we talk about anterior compartment. The anterior compartment has 8 muscles and it arranged 3 layers. Superficial muscle. So the first superficial muscle is the Pronator Teres. The origin is the medial epicondyle of the humor and the cornoid process of the ulna. Insertion is the middle of the lateral surface of the radius. So this is medial epicondyle of humor and cornoid process of ulna. Insertion is the middle lateral surface of the radius. This is the insertion. The nerve supply is the median nerve and the blood supply is the ulnar artery and radial artery. And the function is the burning or forming. Another muscle is the Flexor Carpi Radialis. The origin is the medial epicondyle of humerus. Insertion is the base of the second metacarpal and base of the third metacarpal. The origin is the medial epicondyle of humor. This is the origin, and the insertion is the base, second metacarpal and base, third metacarpal, second and third metacarpal. And the nerve supply is the median nerve supply, and blood supply is the radial artery. Function is the, this is the flexor carpi radius. The function is the flexor and the abduction of the wrist. Another muscle is the Palmaris Longus. The origin is the medial epicondyle of the humerus and medial epicondyle, and we have 3 muscles and they come from medial epicondyle. And the insertion is the palmar aponeurosis and flexor reticulum. This is a palmar aponeurosis. Nerve supply is the median nerve supply and blood supply is the ulnar artery. The function is the flexor of the wrist. This is the flexor. And another muscle is the flexor carpi ulnaris. Origin is the medial epicondyle of humerus. And the insertion is the basiform hook of the hamate, base of the 5 metacarpal. You see, have 3 insertion. And nerve supply is the ulnar nerve and blood supply is the ulnar artery. So this muscle is the exception. So remember, the flexor carpi ulnaris do not supply median nerve. The nerve supply is the ulnar nerve. Do not supply arteries that supply like another artery, but this supply is the ulnar artery. Flexor carpi ulnaris, ulnar nerve, ulnar artery. And the function is the flexor and adduction. Do you remember? Flexor carpi radialis is the abduction, but flexor carpi ulnaris is adduction of the wrist. Don't forget that. And we talk about another layer. The first layer is superficial, and the second layer is the intermediate layer. Intermediate layer has 1 muscle, and the muscle is called flexor digitorum superficial. The origin is the medial epicondyle cornoid process of ulna and anterior border of the radius. This is the origin. The insertion is the middle phalanges of the fingers 2 to 5. Middle phalange. This is the middle phalange. You see, 2 to 5. And the nerve is the median nerve and blood supply is the ulnar artery. The function is the flexor, middle phalanges, and the wrist. You see, the insertion is the middle phalange and function is the flexor, middle phalange, and wrist. deep layers, and this time we talk about the deep layer. The first muscle is the flexor digitorum profunda, and in origin is the anterior and medial surface of the ulna, you know. And the insertion is the distal phalanges of the finger 2 to 5. So flexor digitorum profundus and flexor digitorum superficial is ending in the phalange, but the flexor digitorum is the end distal. And don't forget that a nerve supply is the lateral half anterior interosseous nerve from median nerve and medial half ulnar nerve. Blood supply is the anterior interosseous artery, and the function is the flexus distal 2 to 5. And we talk about flexor Pollicis longus. The origin is the anterior surface of the radius and interosseous membrane. This is the anterior surface of the radius. And insertion is the distal phalange of the thumb. This is the thumb. So don't forget Pollicis longus ended to the thumb. And nerve is the anterior interosseous nerve. Blood supply is anterior interosseous artery, and function is the flexor of the thumb. And we talk about Pronator Quadratus. Origin is the distal anterior ulna, and insertion is the distal anterior radius. See it? So little. And nerve supply is the anterior interosseous nerve, come from median nerve, and blood supply is the anterior interosseous artery. The function is the pronate, the pronate of the foramen. So I hope you understand each other. If you don't understand, please keep watching, keep repeat. I hope you understand, guys. Bye.